Over the past decade, studies have shown persistent gaps within perinatal education that fail to support parents in their transition to parenthood. For parents from global majority communities, so in the UK, Black and South Asian parents, this problem is further compounded by health inequalities. Patients from this population group are 2 times more likely to experience a neonatal death. Postnatal care is the most criticized aspect of maternity services, and the lack of postnatal support has been linked to increased stress, anxiety, and postnatal depression in both parents, and has been linked to poor experiences of the health service and worse health outcomes. As part of the NHS Core 20+5 agenda, and saving babies' lives, there is an urgent need to improve the health outcomes in this patient population. My name is Dr Aiesha Alexander. I'm a pediatrician and a parent living in the UK, and I'm passionate about improving the health and well-being of children and their families. Newborn babies have lots of different quirks and little odd behaviors, and sometimes it's really difficult for parents to identify, is this okay? Is this normal? Is this not? And it causes a lot of anxiety. A lot of the village and support network you used to have around when you had a new baby is gone. My innovation is designed to support parents in the first 3 to 6 months, that postnatal period. And that's because my own experience clinically and as a new parent, I've just found there were so many unknowns, so much confusion and misinformation, and it was really difficult to find evidence-based information that I needed that was culturally relevant. And so that's the problem that I'm trying to solve. I applied to participate in the Health Innovation East Digital Hub because I am a clinician. I don't have much experience in terms of development or app development, although I do have an interest in digital health. Through this program, I've had the experience and access to a platform called Cognis, which is a no-code platform. And that has been really, really instrumental in helping me to take my idea into reality. Because it's no code, I've been able to develop my content into a working app within a couple of weeks. I'm hoping to finish it within the next few months and then test it. And I wouldn't have been able to do that without this program. So the app I'm developing, AweKind, is a health education app. I really want to have culturally relevant and evidence-based information there for parents from multicultural backgrounds. Some of the education that I'm including in there is around things like breastfeeding, weaning onto a diverse diet, general postnatal rituals. So for example, naming ceremonies and things like that, which are very common in certain cultures. Things like how to bathe your baby. And again, if there's a ceremony involved in that, how to do that, honoring your cultural practice, but doing it in a way that's safe and evidence-based. I also hope from a healthcare point of view that it helps reduce attendances to A&E and improves appropriate use of health services. I'm looking for ICBs to help me to test the app with real patients. I would also really like this app to be collaborative, so multidisciplinary and have a multicultural input. So if anyone is working in the charity sector or in healthcare within this space, I would love for you to get in touch with me about how we could work together to improve this app. You often hear people say that babies don't come with a book. I would love for my app to be the closest thing to a book as possible that people need. I hope that it empowers parents to look after their children with confidence, from the small things in terms of feeding to recognizing and understanding when their baby's unwell and they need to come to hospital. I'd really like my app to be available to all Black and brown parents living within the UK across the country.